So, talking about the denture, from the background, talking about the denture, when we try to do this. Any rough areas will hold. Also in the upper. Same thing in the upper. Right? In the upper also you want to see. You want to see. Okay. Yeah. Want to run the gauze. Or run the gauze across and see if there is any area that's going to catch. If there's any area that's going to catch, any rough area, it's going to pull the gauze, and you know you have to reduce it. Now this denture has been well reduced, so I have no issues on the tissue fitting surface. And I want to just show you the occlusal surface as well, so you can see it's well polished. Let me just blow out the zoom here. Yeah. Wow. Well finished, and you can see even the contouring, the wax up is done very clearly. Yeah, and so this is how it goes. In the posterior part, you can see that this is the fovea paltini, very clearly there, and therefore you can know that the extension of the denture is very clearly correctly done. In the lower also you can see the denture has been well finished. You can see the teeth very well there. But you see this one tooth here. You see that clearly there seems to be some wax on it. Look at the inner surface, seems to be some wax on it. So we're going to check for occlusion there in the patient's mouth. Everywhere else it seems to be finished well. The tooth might have been a bit displaced on packing, processing errors for that matter. So you want to observe things like this so that when the patient comes, you're going to check clearly if everything is done. Look at the lingual flange, the way it's waxed up. It's got a concave wax up on both the sides. That's very important for stability of the tongue.